This is called the Adonis distraction brace. So check the action on the side. It actually translates axially to unload the medial compartment. So you can see it translating, right?
Now do that again.
Okay.
Wow. Yeah.
Okay, so now look what's happening inside the joint. So it's bone on bone. We took out the meniscus, so it
Right.
represents a meniscus absent patient. So as you go into extension,
Oh, it opens up space. Look at that.
What do you think?
I think it's amazing. So it's like that's the Misha in a brace, right?
Yeah, pretty much, pretty much.
So you're putting it on the same side. It's distracting on the medial side.
Exactly.
And it doesn't do any varus valgus change. It doesn't do any unloading that way.
It actually has, it includes, so it distracts, but it pulls it into valgus and then it pries it open.
Oh, so it does a valgus maneuver and
Yeah,
both.
exactly.
Well, that's impressive.
Yep.
I love it.
So it's the opposite for lateral unload, except we have this distracts from say 45 degrees to 0.
Now, is this based on the same hinge that we have in all the other various braces?
Different hinge.
That's what I was going to say.
Totally different.
And it's patented, I gather, yes?
It's patented, yeah. Don't worry.
It's impressive. I'm just so impressed because it's the right idea.
So we actually see.
Now, is this available? Is this available now?
Right now, custom and off the shelf.
And we're calling it not the Ascender. It's called the Adonis. Gotcha.
The Adonis.
I love it. All right, I'm impressed as always.
Adonis, and this uses joint distraction to pry the joint apart to unload either the medial compartment or lateral compartment. So
on one side only.
On one side only. So that's your unit compartment. So the Ascender is patellofemoral or multi-compartment.
That's an extensor. So yeah, extensor scissor. That's one I know.
Yeah.
This is cool. That's awesome. Good job.
Yeah, thanks. Okay, now look at this. Okay, so this is how it actually works. So you saw the action of the hinge on the side. Okay, so now look what's happening in the joint. We remove the meniscus.
So you got to strap these pretty tight in here.
You do, and you can control how much distraction you want by how tight these guys are. But when you push it up, you actually see spacing occurring. So yeah, we're really excited about it. How often do you see medial or lateral play? Never on the weekends.
I mean, right? This is the difference with the traditional uploader. You're just pushing, right? You're going bold,
right?
And this is lengthening here.
Exactly. So yeah, basically, it's pulling.
It's probably less
while it's
uncomfortable than a true uploader. Huh?
Yeah. That's what we're seeing so far.
Well, I think it's interesting that you actually get the distraction on the side that you're trying to offload. I think that's fairly unique. I like the single post construct. It's very light. Yeah, I'm excited about it.
Yeah, but then we decided to develop a single upright brace. We call this a distraction hinge. So when you go into extension, it translates axially to pry the joint apart, and so feel like
interesting.
That. So that should be the lightest.
Yeah, this is like
on the market.
Interesting. Yeah, no, I'm pushing on it. It won't do it. Yeah, it's not doesn't hop. Yeah. It's really smooth.
Yeah.
Very, very interesting.
Okay, and then this is what it looks like on a model. So you can see it's pretty much fully contracted at 90 degrees. And then as you go into extension, it starts to distract. So watch what's happening in the joint. So you've got a meniscus here. We remove that meniscus. It's bone on bone, full contact there. But as you go into extension, you can see it creating joint spacing there, prying that joint apart. And so we actually see varus correction on this brace. We need more data on that. But yeah.
Interesting. So, interesting.
Different way of unloading.
And do you find one of the biggest problems with most braces that people complain about our ACL braces, this, that, whatever, is, that the brace drifts. Do you find that you need an undersleeve with this type of brace or not?
You don't. You can. So we recommend wearing it directly on the leg.
Right.
So it has a high friction interface material here, but
Mhm.
also it pulls you into valgus while then distracting. That sort of compressive force is so high that
Holds it from sliding.
this thing will not migrate. Yep. So the idea is that it's super light.
Yeah, super light.
And it focuses the action of this hinge on the medial compartment or the lateral compartment. And here's how it works. So you can see from this side, you can see how as you go into extension, you can see it starting to distract internal extension. And now if you look to see what's happening actually inside the joint, you can see it actually creates separation in the joint.
Okay.
So I just want to know, what's your just candid feedback? What are your thoughts?
I like that it's light. Patients like things that are light. I like that it's opening up space where the biggest issue we have is compression. And compression leads to increased contact pressure, peak force, and from a clinical perspective, pain. And so if we can increase that space, that's ideal. If we can do it through a non-surgical means, for many patients, that's a game changer because a lot of patients don't want surgery or don't want to recover from surgery. I think as a surgical tool, especially for cases where we're trying to get a little bit more space, like cartilage, meniscus, allografts, this could be a great post-operative tool as well. So initial feedback is I'm excited about the technology.
So
Principle sounds great.
Sounds good. Yeah.
Yeah.
So that's for medial or lateral OA. It is for unloading meniscus repair, post-op unloading.
Cartilage procedure. Yeah.
Yep.
Yeah.
And so some people are, they might have them immobilized for the first week or two, and then put them in a distraction
Yeah.
medial unloader.
Principle's good.
Yeah. What else? What are your other thoughts?
None. Principle is great. Just have to clinically show studies where it works.
Yeah. Okay.
I actually I used another company,
Uh-huh.
another system,
Mhm.
and we need to make something on the bottom here.
So you can
And
adjust
we
the
use,
tension.
but I used it during 2 or 3 months and I forgot. But this is make more interesting because you just wear it and go ahead.
Yeah.
I like it.